Welcome to today's Explainer. I am so thrilled you're here because we're jumping right into a topic that affects millions of people, yet somehow still feels wrapped in a bit of mystery. Today, we're going to demystify how the human body communicates with us through menstrual signals and really dig into why irregular cycles happen so frequently. You know, our bodies are just incredibly smart. They're constantly sending us data, and when it comes to reproductive health, the menstrual cycle is basically one of the most powerful diagnostic dashboards we've got. So, let's power up that dashboard and start decoding.
So, tell me, has your period ever come way too early, super late, or just not at all? If you're nodding along right now, I want you to know right off the bat, you are absolutely not alone. Irregular periods are incredibly common, but more importantly, they are vital clues. When your cycle strays from its usual rhythm, it's not just some random glitch. It's actually your body actively trying to tell you something really important. And our whole goal today is to figure out how to listen to and translate those clues.
Okay, here's our roadmap for today. 1. Decoding irregular menstrual cycles. 2. Why irregularity happens frequently. 3. Warning signs to watch. 4. Healthy habits for menstruation. And 5. When to see a doctor.
Let's dive right into Section 1, Decoding Irregular Menstrual Cycles, the baseline versus the signal.
Before we can even begin to figure out why an irregular cycle happens, we really have to establish our biological baseline. A standard, healthy menstrual cycle usually lasts somewhere between 21 and 35 days. But if your periods come unpredictably, like constantly jumping around way outside that window, or if the flow is exceptionally heavy or light, well, that predictable rhythm has been disrupted. And crucially, if you're skipping entire months when you know for a fact you weren't pregnant, that is a major signal from your body that something is off track.
Moving on to Section 2, Why Irregularity Happens Frequently. Time to decode those disruptors.
So, what actually throws that nice 21 to 35-day baseline into chaos? Honestly, it almost always comes down to our delicate internal balances. Hormones are the chemical messengers controlling everything, and even microscopic shifts can cascade into major timing changes. One of the biggest culprits we see is polycystic ovary syndrome, or PCOS. It affects millions and is actually the most common cause of missed periods. And please do not underestimate stress. Emotional stress literally rewires the specific hormones that regulate your ovulation. It essentially tells your reproductive system to just hit the pause button.
But the list of disruptors definitely doesn't stop at stress and PCOS. Think about weight. Rapid weight gain or loss can severely throw off your estrogen levels. Then there's your thyroid, which is basically the master regulator of your metabolism. If it's overactive or underactive, it can significantly disrupt menstruation. And of course, natural life events like pregnancy and breastfeeding will totally pause or scramble your cycle. When you think about all these everyday variables, it makes perfect sense why irregularity happens so frequently, right?
All right, Section 3, Warning Signs to Watch. Let's look at the secondary signals.
Because, let's be real, a disrupted timeline rarely shows up to the party alone. There are usually direct, physical symptoms that accompany it. We're talking about missing a period entirely, spotting between periods when you definitely shouldn't be bleeding at all, unusually heavy bleeding, or severe debilitating cramps. Now, mild cramping is pretty standard for a lot of us, but debilitating cramps that happen right alongside an unpredictable cycle, that is a loud and clear message that this mere irregularity is escalating into a much larger problem.
And the warning signs aren't just isolated to bleeding and cramps either. There are broader bodily signals that love to accompany irregular periods. Things like sudden or persistent acne, the growth of excess facial hair, intense mood swings, and general pelvic pain. If you're noticing these happening regularly alongside your unpredictable cycle, especially the excess facial hair and acne, which really strongly point back to hormonal issues like PCOS, it is highly recommended that you consult a healthcare professional.
Which brings us to Section 4. Healthy habits for menstruation, taking control.
We've talked a ton about what goes wrong, but what can you actively do day to day to help? Well, it starts with the absolute basics. Giving your body the building blocks it needs for hormone production through a balanced diet, staying hydrated, and actually getting those 7 to 9 hours of sleep. Regular exercise and maintaining a healthy weight are great for keeping estrogen balanced, but a quick heads up. Excessive, extreme workouts can actually create physical stress that stops your period entirely. And throwing in some mindfulness, like yoga or deep breathing, can work wonders for that emotional stress we mentioned earlier. Just remember, these habits are amazing for creating an optimal environment, but they might not treat underlying medical conditions.
And finally, Section 5, When to see a doctor. Let's cover the medical thresholds. Because as great as healthy habits are, sometimes they just aren't enough. You really need to know exactly when it's crucial to seek medical advice. You should definitely see a doctor if you miss your periods for more than 3 months in a row, or if your bleeding is extremely heavy or lasting longer than 7 days. If you are experiencing severe, life-interrupting pelvic pain, don't just push through it. And of course, if you suspect thyroid issues or PCOS based on symptoms like those sudden weight changes or excess facial hair we talked about, do not wait. Early diagnosis is truly your best tool for getting to the root of these disruptors and taking care of your long-term health.
To wrap up today's explainer, I want to leave you with this really powerful takeaway straight from our source material. Irregular periods are common, but they shouldn't be ignored. Understanding the cause is literally step 1 toward better health. I know it is so easy to brush off an unpredictable cycle and just blame it on a stressful month at work or school. But as we've seen, those signals actually mean something. So I'll leave you with this final thought to ponder. If your body is using your cycle as a diagnostic dashboard, what crucial message might it be trying to send you today? Thanks so much for hanging out with me. Stay curious and keep learning.